Today we will try to understand a normal chest X-ray. First thing for every investigation, ensure it is of the same patient being examined. In hospitals, such errors occur in which patients' lab or radiological investigations are interchanged even between departments. So before proceeding, patient ID and name should be confirmed. Time on which an investigation has been done is also of paramount importance to ensure whether an investigation has been done in relevant time frame. Patients sometimes show old X-rays instead of fresh ones in hurry. Old X-rays are also significant. Check old X-rays for comparison to look for any acute issue. Chest X-ray view. Mostly chest X-ray PA view is done, in which chest is placed onto the detector. In ICU settings, for bed-bound patients, AP view is done with detector underneath. In AP view, there is scapular shadowing as well as heart size is increased in AP view. Now rotational symmetry. Normally the spinous processes of vertebrae are in almost straight vertical midline and spinous processes are equidistant from medial ends of both clavicle. This is a mal-rotated X-ray. Spinous processes are not equidistant from medial ends of both clavicle. Spinous processes are not in straight vertical midline as well. Same goes here. Spinous processes are not equidistant from medial ends of both clavicle. Spinous processes are not in straight vertical midline as well. An X-ray film shouldn't be underexposed or overexposed. An optimally An optimally exposed X-ray shows both pulmonary vascular markings and vertebral bodies behind the heart. A fully inspired lung shows better visualization of structures, so during an X-ray, whether patient inspired completely matters. The anterior end of approximately 5 to 7 ribs should be visible above the point at which the midclavicular line intersects the diaphragm. Less than 5 ribs indicates incomplete inspiration. To differentiate between anterior and posterior ribs, anterior ribs are slanting downward while posterior ribs are a bit horizontal. You can feel inclination of anterior ribs while palpating your rib cage as well. In some pathologies, diaphragm is flattened. For a normal diaphragm, the highest point of diaphragm should be at least 1.5 cm above a line drawn between the costophrenic and cardiophrenic angle. Other thing is the right hemidiaphragm is 2 cm raised as compared to left hemidiaphragm, and elevation more than 3 cm should be considered pathological. The cardiothoracic ratio is defined as the ratio of the greatest transverse dimension of the heart to the greatest transverse dimension of the chest cavity. Cardiothoracic ratio greater than 0.50 or to some radiologists 0.55 suggests cardiomegaly. This slide shows trachea, aortic knuckle, left main bronchus, right main bronchus, and carina, that is bifurcation of trachea. There is a subtle and clinically important difference between right and left bronchus. Right bronchus is more widened and slanting downward, left bronchus is narrower and horizontal. Hilum or hyla contains bronchi, pulmonary vessels, and bronchopulmonary lymph nodes. The left hilar point is higher than right hilar point due to elevated position of left pulmonary artery. Same density of both hila and normal branching pattern indicates a normal hilum. These are the bronchovascular markings. Usually lymph nodes don't show on normal chest X-ray. Costophrenic angle forms between chest wall and diaphragm. It is actually a triangle with apex pointing downward. Costophrenic angle should be acute or sharp normally. Normal costophrenic angle measures approximately 30 degrees. Alteration in shape and angle may occur as part of blunting and usually indicates pleural or pulmonary disease. Here you can see a few structures: oblique fissure in left lung, oblique fissure in right lung, horizontal fissure in right lung, trachea, carina, right and left bronchi, manubrium of sternum, aortic arch, pulmonary trunk, superior vena cava, inferior vena cava, and diaphragm, gastric bubble, right atrium, left atrium, left ventricle, and costophrenic angle. You may not be able to view these all, but you can have fair idea where all these lie. Now lateral view. Left costophrenic angle, right costophrenic angle, left atrium, left ventricle, right ventricle, trachea, aortic arc, left main bronchus, sternum, and gastric bubble. Thank you.